Hi, thank you very much for watching this video. My name's Stuart, I'm one of the critical care practitioners at Dorset and Somerset Air Ambulance. I'd like to take this opportunity to show you some of the critical care equipment that we carry on the helicopter and also on our critical care cars. The equipment that we carry at Dorset and Somerset Air Ambulance is quite unique in the world of air ambulances and critical care, and this is a good opportunity to demonstrate the amazing equipment that you have supported to buy for Dorset and Somerset. Dorset and Somerset exists purely on your donations, and this has brought some amazing equipment that we can use to benefit our critical care patients. Let me start at this end. What you can see here is one of the critical care ventilators. This is called a Hamilton T1. The importance with the Hamilton T1 is it's an intensive care or critical care style ventilator that copes with all sizes of human beings. So this ventilator will ventilate the very smallest child up to the adults. And as you can see now, it's got the small neonatal software and the neonatal tubing on, and that allows it to ventilate the very smallest baby. We also carry suction. The suction equipment that we carry clears the airways of patients. The important thing with this is, like all of the equipment that you see in front of us, that actually it's approved and certified for use on aircrafts. As you can see, the device has got the aircraft approval on it, and that means that it doesn't affect any of the avionics or any of the functions within the helicopter. This equipment is essential to be certified for use on air ambulances. Moving down to some more bespoke airway equipment that we carry, I'm holding now the Glidescope Go. The Glidescope Go is one of the latest and newest video laryngoscopes on the market. It comes with a selection of blades to allow us to put airways into patients and to be able to see as a team what is going on in the screen in front of us. This ensures at all time not only the practitioner or the doctor that may be undertaking the intubation, the procedure, but everyone around them can see what's going on in the video. That improves the human factors and the safety profile of intubating patients. And again, this is a great piece of equipment. The next thing I'd like to show you is what we call a point of care testing system, or an iStat machine. The Abbott iStat machine will give all of us at the critical care team blood results that you would usually get in a hospital within 2 minutes on this piece of device. All we do is insert a small amount of blood on a cartridge at the end, and what that will do then is will give us a whole selection of blood parameters. That's whether the breathing is going well, the metabolic state is going well, the patient's electrolytes are good, and it also gives us an idea of what their kidney function is doing by looking at urea and creatinine. It's a really good piece of kit, and it gives us hospital standard blood results pre-hospitally. So at the roadside we can get those blood results straight away. Another medical device I'd like to talk to you about is the iVis. This piece of equipment is known as an ultrasound machine, and what it allows us to do is to use the different size probes to scan the patient. And what we do by using the iVis is scan the heart, the lungs and the abdomen of a patient, looking at all of the organs to see if there's any injuries. This piece of equipment really helps us to make clinical decisions about the patient. Has the patient got a pneumothorax? So have they got air in the wrong part of their lung? You know, and is that significant? This helps us make decisions on whether the patient can go to the local trauma unit or the major trauma unit with all the other equipment around us. One of the other pieces of equipment that I want to talk to you about is our critical care monitor. What we use at Dorset and Somerset Air Ambulance is the Zoll X Series Advanced Parameter. What this tells us is gives us a picture on the screen about the patient's heart rate, their blood pressure, their oxygen levels, and specialist parameters like the carbon dioxide. That's really important when you insert a breathing tube, when you intubate a patient. The Zoll Advanced also gives us other parameters which are really quite unique to the service. They will give us an indication about the haemoglobin, so the amount of red blood cells in the patient, and also the trend of that haemoglobin within the patient. That gives us an indication whether the patient is bleeding, whether the blood products that we're giving them is working, and again it helps us make decisions on where the best place is to take the patient to. Last but not least in this short video, I'd like to show you the Lucas device. This is made by Stryker, and this provides cardiac compressions to the patients in cardiac arrest. The importance with the Lucas device is actually, if I was doing CPR, and most of you have had CPR training, I would get tired after a certain amount of time. The benefit with the Lucas device is it will keep going consistently at a perfect rate, at a perfect speed, and a perfect depth. And that allows us to provide the best compressions to get the blood and oxygen around the body for our patients. As you can see, it's completely portable, so if we were in a vehicle, we wouldn't have to stand up and do CPR. CPR could go on while we were sat down and strapped down safely. Thank you very much for listening to this short video about some of the equipment we have at Dorset and Somerset Air Ambulance. I encourage you to look at the pictures on the website, which will give you a very brief summary of what they cover and what they're for. And again, by all means, you can email us and ask about our equipment that we carry. Thank you for your support, thank you for your donations, and again, thank you for listening.